Hi guys, today I'm going to explain to you about osteoporosis disease, which makes the bones weak and break easily. According to a finding, binge drinking may increase the chance of getting osteoporosis in later life. The findings show that drinking too much alcohol, over a short duration, may impact genes involved in bone formation. Binge drinking occurs when a female has at least 4 alcoholic drinks in a hurry. However, for males, binge drinking occurs when he has 5 drinks and a short duration. America's Substance Abuse and Mental Health Services Administration indicates that binge drinking begins normally when a person is about 13 years old. Research involving adolescent laboratory rats was carried out to study the effects of binge drinking on their genes. They injected alcohol into the rats. That resulted in a blood alcohol level of 0.28 in many American states legally. A person is considered dead drunk when the alcohol level in the blood reaches 0.08. Some rats were injected with alcohol once a day for 3 days. The alcohol affected 300 bone-related genes in those rats. The other rats were injected with alcohol daily, but the injections continued for 4 weeks. In such cases, 180 genes were affected. The injections included ribonucleic acid to the genes of some rats, while the other rats, the Ra and the genes decreased. Ribonucleic acid instructs the gene how to make proteins, the substances needed for bones and other tissues. Therefore, the change impeded with the molecular pathway that is accountable for bone construction. One of the most agonizing findings came 30 days after discontinuing the injections. That time the rats yet show differences in the way their genes were expressed. 30 days of a rat's life, or equivalent to 3 human years. It is not essentially correct that what happens to the genes of rats will happen to human genes. But the findings suggest that binge drinking of alcohol by young people could indicate problems in their future. Bones are living tissue that continually break down and then rebuild themselves. However, as people grow older, the breakdown of bone is more than the reconstructed bones. As a result of this phenomena, small spaces inside the bone get larger, making it hollow, and the bone's shell gets thinner. The term osteoporosis means porous bones or weak bones. By removing calcium and other essential minerals from tissue, osteoporosis harms bones. 8 of every 10 osteoporosis patients are females, and it is very common in Caucasian females, over 50 years before developing osteoporosis. The patients experience a condition called osteopenia. Timely treatment can prevent this condition from developing osteoporosis. Osteoporosis and osteopenia can be detected by measuring the mineral density of the bones of the patient. Here, density means the strength of the bones. There are a number of ways to measure bone mineral density. The hip spine, or backbone, is used to examine the bone mineral density. A diagnosis called dual energy X-ray absorptiometry is the best method to diagnose osteoporosis. That involves the use of X-ray radiation. That it's only a few minutes. Peripheral bone mineral density test is another method to measure bone density. That is often used in the US to examine if the patients are at risk of osteoporosis. This test costs less than a dual energy X-ray absorptiometry test. However, peripheral testing measures only one part of the body, and it is usually the heel, the wrist, or the bones between the finger joints. However, a shortfall of this test is when their patient has normal bones in the tested areas and has effective bones and other parts of his body. Then it cannot detect the disease. Therefore, often, the peripheral test can show normal results of the patient who has osteoporosis in their backbone or hips. Initially, the disease decreases the mineral density in the spine bone. The mineral density of the bones of all parts of a woman is almost similar when she reaches 70 years of age. In such cases, the bone mineral density diagnosis of lower. Take 1,200 milligrams of calcium per day and 800 to 1,000 international units of vitamin D. Vitamin D2 as well as vitamin D3 are good for bones, milk and milk products, fish with soft bones like salmon, and dark green leafy vegetables. Orange juice, bread and cereals are rich in calcium. However, one should be very cautious about the intake of calcium. It should not exceed 2,500 milligrams a day, including adding calcium from foods, and all other sources. Too much calcium can result in kidney stone disease. Vitamin D absorbs calcium. There are many drugs to treat osteoporosis, of which bisphosphonates are the most popular. Fosamax, Actonal, and Boniva are products of this group of drugs. High rate function. The thyroid is a tiny gland in the lower front part of our neck that is responsible for regulation of many of the body's processes such as energy generation, metabolism and mood swing. The two hormones secreted by the thyroid gland are thyroxine and triiodothyronine. If the thyroid gland does not secrete enough hormones, one may experience symptoms like lack of energy, weight gain and depression, which is called hypothyroidism. However, in case the thyroid gland secretes too many hormones, one may experience weight loss, increased anxiety, tremors and a sense of being on a high. This is called hypothyroidism. This is a condition which is classified by a decline in the thyroid hormones in the blood. It majorly occurs if the patient is suffering from underactive thyroid or glands that control the thyroid functions, though. There are other various factors that can result in this condition. Typically, hypothyroidism affects females more than males and worsens as they age. Let me now explain to you the common causes that could result in a decline of this hormone, giving rise to hypothyroidism. The Hashimoto's disease is an autoimmune disease that attacks the tissues of the thyroid gland. Often females suffer from this particular autoimmune disorder more than males. That can possibly be due to an underlying genetic link. The thyroiditis is such a condition where the thyroid gland remains inflamed, resulting in less enough thyroid hormone. Often this condition affects pregnant women, and usually this phase is followed by a hypothyroid phase that remains up to 6 months. The radioactive treatment for hypothyroidism can always lead to an unpleasant outcome: underactive thyroid or hypothyroidism. The possible reason is that the therapy might have considerably eroded the gland to secrete enough hormone for an optimal functioning, usually following a radioactive treatment. The thyroid gland always becomes underproductive for a few months. However, if the gland completely stops functioning, then the condition can be identified as hypothyroidism. The malfunctioning of the other glands can also result in hypothyroidism. For instance, a malfunctioning hypothalamus or pituitary gland can result in hypothyroidism. At times, certain medications taken to treat hypothyroidism can also result in hypothyroidism. Often a diet that is low in iodine becomes a major cause of hypothyroidism and adults significantly. The regions with poor iodine resources can have a greater number of hypothyroidism patients. Hypothyroidism. In the hypothyroidism condition, the thyroid gland becomes overactive and secretes abundant hormones in the blood. The Graves' disease is a common cause for hypothyroidism. In the disease, the immune system is supposed to release antibodies that mimic the thyroid stimulating hormone and secretes abundant hormones that are released into the bloodstream, the nodules in the gland. As we age, lumps are developed in this gland that are non-functional or inactive. However, in some instances, these lumps start functioning on their own, secreting more hormone without their support of the pituitary gland. Certain medications taken to treat ISM can also result in ISM. Thyroid enlargement is also a condition of hypothyroidism that occurs due to any structural changes in the gland. The enlargement of the thyroid gland is